So yeah, moving on to the next presentation here. So we will be having Dr. Janet Lydecker speak to us. If you could just give me a second to pull up technical shifts here. Okay, so for all those now coming into the room, so hello, welcome again to afternoon sessions. My name is Alex. I'm a first year neuroscience PhD student at Yale. Some housekeeping. The session itself will last about 30 minutes. The first 20 will be presentation, followed by 5 to 10 minutes of time for questions. Please use the WOVA chat to ask any questions, chat at all. We've disabled unmuting and hand raising on Zoom just to avoid disruptions to presenters. And then, rest assured though, presenters and our team will have access to your questions and comments. We're able to see that. So with that being said, really looking forward to the session, and I'm excited to introduce Dr. Janet Lydecker. So take it away.
Thank you, Alex, and thank you all for coming. I will just add that there's going to be a couple of interactive things during the presentation. So if you have a piece of paper and a pen to jot some things down in front of you, you can do that, or you can drop any thoughts that you have in the comments as we go. And like Alex said, we will have the questions and answers at the end, so feel free to add them to the app. I am going to share my screen now. And get started. So today we are going to talk about eating disorders and how they relate to both weight stigma and well-being. Before I get into the topic, I want to start with an activity that will get us thinking about body image and eating disorder messages that we've seen here. I want you to watch this 1-minute clip and think about what eating disorder messages are coming through. If you know the film, feel free to pull some eating disorder messages from the rest of the film as well.
My dear sweet child, that's what I do. It's what I'm here for, to help unfortunate merfolk like yourself. Poor souls with no one else to turn to. I admit that in the past I've been a nasty. They weren't kidding when they called me, well, a witch. But you'll find that nowadays I've mended all my ways. Repentance and the night need a switch. 2 years. And I fortunately know a little magic. It's a talent that I always have possessed. And dear lady, please don't laugh. I use it on behalf of the peaceful, lonely, and depressed. Poor unfortunate souls in pain, in need. This one longing to be dinner, that one wants to get the girl, and do I help them? Yes, indeed. Those poor unfortunate souls.
All right, we're going to stop there. So again, if you want to jot down some of the things that you noticed, eating disorder themes, either in the chat of the Whova app or just on a piece of paper, I am going to go through some of the things that I saw in this clip. So usually the first thing that people notice when they talk about children's media and body image is the appearance of the hero, the character that children look up to or side with. So it's no stretch to say that Ariel in this clip is thin. And not only that, her mermaid tail and her movements show off the thinness. We also hear a theme of body dissatisfaction in this clip. So the unfortunate soul who wanted to be thin. And we see the theme that attractiveness and happiness are contingent on thinness or muscularity for the male unfortunate soul. And then from other parts of the film, we know that for Ariel, the body is more important than anything else. Her deepest desire was to change the unacceptable part of her body. And she was willing to give up everything for that, including her voice, her power, and her identity. So hold that clip in your mind, as well as the eating disorder themes as we go through this topic. I'm going to start by introducing weight stigma. So weight stigma is understood to be negative attitudes or assumptions about people because of their weight. These are a few of the common stereotypes that are applied to people with larger bodies. But weight stigma isn't often acknowledged as a reason why people are discriminated against, and it's not always considered to be unacceptable the way other isms are. So you're probably aware that over the past few decades, average body weight has been increasing. So one thing I hear from parents pretty often is that because kids are heavier these days, say compared to when the parents themselves were growing up, their child isn't going to stand out as much and therefore won't be a target for teasing or bullying. But while that might sound like it should be true, what we actually see is the opposite, that weight stigma has increased. So this is a visual of a study that was done originally in 1961 and then again in 2001. Researchers showed 5th and 6th graders pictures of kids, and they asked them to rank the kids according to how much they liked them. So there was one child with no visible disabilities, others had various physical disabilities, and then there was one child with obesity. So as you can see, in both 1961 and 2001, they found that the most liked child was the healthy child, and the least liked child was the child with obesity. And over the course of the 40 years, preferences for the healthy child strengthened and dislike of the child with obesity worsened. So what? Why is weight stigma a problem? First, like other isms, negative attitudes can translate into discrimination that happens in many different settings. Weight stigma is also a stressor, and therefore it's related to poor health. So for example, weight stigma has a negative effect on cardiovascular health over and above any effect of body weight itself. Second, when weight bias is widespread in society, like it is in ours, children and adults with obesity internalize the weight stigma and believe the negative stereotypes about themselves. Weight bias is associated with disordered eating, when kids want to escape the negative feelings or are desperate to change their bodies to fit in. So let's switch gears now and talk about eating disorders. I want you to think about who comes to mind when you think about who might be at risk for an eating disorder or who is likely to have an eating disorder. Think about some adjectives that might come to mind. And again, you can drop them in the Whova chat, or you can write them down on a piece of paper if you don't want to share. So who you imagined is different from who's actually at a higher risk of developing an eating disorder. The risk factors that have been identified by the scientific literature relate to feeling a pressure to control the body through eating and how much negative affect or negative emotions people feel. Genetics also play a role, and there are likely many, many other risk factors that we haven't yet even discovered. So who you imagined is more likely to map onto what we call the eating disorder stereotype. And this stereotype is based on a partial truth. So the stereotype is, or at least was, the prototypical example of a person who has an eating disorder. But the stereotype is not the full truth, and it's far from the full truth. Eating disorders don't discriminate. They affect all genders, all races, all cultures, all sexualities, all religions. And it's dangerous to rely on the stereotype because it means that we're likely to miss eating disorders, and the consequences of missing an eating disorder could be years of suffering or even worse. So back in 2019, we did a study that tested the power of the stereotype that people with eating disorders are always thin. In this study, we had adults read a fictitious doctor's note. They were then asked some questions about the patient and about bulimia. When participants didn't know, or what they didn't know, was that they were only reading 1 out of 6 vignettes, we changed whether the fictional patient's body weight was in the underweight, normal weight, or overweight range. And then we also changed how severe the fictional patient's bulimia was. What we found was that when participants read the vignette about an individual with a higher weight, they were more likely to blame the person for their illness. And they were less likely to believe that what was going on was a mental illness. How severe the bulimia was didn't matter. So again, this illustrates part of the eating disorder stereotype. And as I go through the eating disorders individually next, I'm going to pay attention to high body weight as a context for all of those eating disorders, but I could just as easily focus on any other aspect of this stereotype. So first, anorexia. Classically, anorexia is this image. It's a severely underweight, often emaciated person who refuses to eat. However, anorexia can also be losing a significant amount of weight over a short period of time, even if the weight where the person ends up is not in the underweight range. We call this atypical anorexia, but it's actually more common than typical anorexia. And it's more severe, usually because the anorexia has been around longer because it was undetected. Medical complications are worse. Body image thoughts are just as toxic, and sometimes even more so because many people with atypical anorexia were praised for weight loss when they first started losing weight. And that makes the eating disorder stronger and harder to treat. Bulimia is when people feel out of control while they're overeating, and then they purge the calories they consumed during a binge. Like anorexia, it's assumed that people with bulimia are underweight. However, the average weight of individuals with bulimia is actually in the overweight range. So if we follow this stereotype, we'd miss more than half of the people with bulimia. The third eating disorder I want to mention is binge eating disorder. Binge eating disorder is similar to bulimia in that there are binge eating episodes, but there are no purging episodes. Binge eating is traditionally associated with overweight and obesity. Many patients end up seeking weight loss treatment before they seek eating disorder treatment, even though they're distressed by the binge eating and by clinically significant body image concerns. It is worth noting that not all patients with binge eating disorder have obesity. Not all patients want to lose weight. Again, we have to be careful not to put assumptions onto individuals. But when we are treating binge eating disorder with someone with a higher weight, what we're often struggling against is internalized weight bias. Part of what we do is we encourage regular eating, so not skipping meals, in order to make the binge less likely to occur. And that's a really tough thing to do if you believe that you should always be on a diet. So what are we doing? Yale Teen Powers studies work with middle school and high school students, developing new behavioral therapies that we deliver over telehealth, and we're trying to reduce eating disorder symptoms. I want to make a quick comment on bullying, which is the second study on the screen. So why did we choose bullying? Most teens with obesity are bullied or teased because of their weight. And about 1/3 of all children who are bullied end up developing post-traumatic stress disorder because the bullying was so hurtful. In addition, weight bullying can increase that pressure to have a specific appearance to fit in, to not be bullied. And that can drive a desire to control eating and control the body and eventually lead to eating disorders. So that's what we're doing. I want to take some time and talk about what you can do. So first, eating disorders are serious. Don't fall into the myths of believing that eating disorders are vanity or something that it's easy to snap out of. And second, weight stigma and a drive to fit an appearance ideal underlies eating disorders, even if the ideals look different for different people and different disorders. Weight bias is everywhere. Our society has an implicit bias, and most people with obesity have been treated poorly at some point because of their weight. Paradoxically, just being aware of bias and stereotypes isn't enough. Increasing your own awareness and others' awareness of weight bias can actually make things worse, not better, because it makes the bias feel normal. It makes people feel helpless to see change. But we aren't helpless. I'm going to give you 3 ways to prevent bias and 3 ways to challenge bias. These are different tools that are taken from other work on other forms of bias, such as race and gender, but it applies to weight stigma as well. So first, whenever possible, remove information that can trigger bias. So one thing you can do is monitor yourself. How do you talk about food or the body? If you're having a bad body image day, it can be really hard to be positive when you're not feeling that way. And kids know when you're faking it. So not commenting on eating habits or exercise habits or appearance might be the most helpful at times. Second, think about and commit to your definition of health. Health is not the same as body size. We're used to using body size as a proxy for health because it's statistically associated with health problems, but that doesn't mean they're the same. Health is physical illness. It's breathing and diabetes, heart, joints. It's also mental health, mood, worry, meaningful social relationships, functioning. It's important to think about what is health for you and commit to that definition. Third, broaden your exposure. Social media algorithms can put us in a position where we see only certain types of images. Unfollow accounts that have a toxic push towards the thin ideal and follow accounts with a diversity of body sizes. Also, as a side note, because it relates to all 3 of these here, the words we use are meaningful. I won't get too much into language preferences, but you should know that there are people who consider the word obesity and especially the label obese to be offensive. And offensive because they're tied to those negative stereotypes about people with larger bodies. So in terms of challenging bias, when you see weight stigma, the key is to think about it critically. What would it feel like to have a larger body? Or to be the person who experienced the weight bias you just saw? What is weight being blamed for, and what else might be to blame? Stereotypes have a purpose in human cognitions. We can't know everything, so they're a shortcut, and they fill in the gaps of what we don't know. But you can fill in the gaps too. If you emphasize information about the individual, you can fill in the gaps so the stereotype doesn't do it for you. And lastly, name the bias. It can be as simple as naming it to yourself. If you're watching a commercial and there's a guy with obesity who is unmotivated, say out loud that there's no evidence for that assumption and that the commercial is using the stereotype to communicate quickly. And then do it all again. Weight stigma won't be overcome easily. It takes repeated practice. So I want to take a minute and practice. We are going to go back and watch Ursula and Ariel. And this time when you watch, I want you to look for any themes of weight stigma that come up.
My dear sweet child, that's what I do. It's what I'm there for, to help unfortunate merfolk like yourself. Poor souls with no one else to turn me to. I admit that in the past I've been a nasty. They weren't kidding when they called me, well, a witch. I shall find that nowadays I've mended all my ways. Repentance and the active lead a switch to years. And I fortunately know a little magic. It's a talent that I always have possessed. And dear lady, please don't laugh. I use it on behalf of the peaceful, lonely, and depressed. Pathetic.
All right, and we'll stop there. So hopefully the first thing that jumped out at you after hearing this talk was that Ursula has a larger body. And we see a few of the stigmatizing beliefs about obesity come up, that Ursula is repulsive, that the unfortunate soul with a larger body must be lonely, depressed, and pathetic, that Ursula is untrustworthy. So let's challenge the stereotype. Let's talk about what just happened and what we saw. So what we saw was that Disney took advantage of the stereotypes about people with larger bodies to make us side with Ariel, and that could create a preference for a thinner body. If I were Ursula, I wouldn't want those assumptions put on me, and I'd work hard to fight them like she's doing. It's not fair. In this case, the rest of the film does convince us that Ursula deserves to be thought of as the villain, but we should really make that choice based on villainous actions and not on her body. So thank you all for coming today, and a brief thank you to my wonderful colleagues as well as the funding sources that helped me study and learn about eating disorders. I have some resources for you that I'll make sure to drop in the talk page in the Whova app. So be sure to check them out, and please do get in touch, especially if you have a teen who could benefit from our programs or if you have questions. So with that, we can take any questions that there are.
Yeah, thank you so much. My name is Bruna. I'm one of the co-chairs. Thank you so much. Janet, I think we've been emailing each other at some point, so I was very much looking forward to your presentation for the day. So very exciting, yeah. I told Alex that I wanted to moderate this session because, at least the questions, because I feel very strongly about this. So there is a question here that says, we continue to further weight stigmatize people by using BMI and making a separate category for those with anorexia in larger bodies. We have to classify it as atypical. We as medical and psychiatric professionals keep reinforcing it. So I think what they mean is that I think a lot of us use BMIs, and Elizabeth, you can of course correct me, but you know how we use BMI, and often like how we can, I think what she's trying to say is how can we change this when we as medical and psychiatric professionals keep reinforcing the BMI?
Yeah, so you cut out a little bit in the middle, but I think I got the gist of the question. So please let me know if I did not. So BMI is fundamentally the ratio of height to weight, and it's a formula that has been mapped onto different categories, but the categories are arbitrary. So thankfully, we have made progress with anorexia where there's no longer a specific cutoff, and it's never been very clear, but there's no longer a cutoff that someone has to be under to be diagnosed, but we do still have this higher weight, lower weight, obesity, overweight, different categories that we go through. And maybe even more problematically, there are people who avoid healthcare if they know that they're going to be weighed when they first get to an appointment. So I think to answer your question a little bit about how we can help, I would say we can think about whether we need a weight at a visit. So there certainly are some visits in our clinic. We do take a weight at every psychotherapy visit, and we do that so that we can avoid colluding with avoidance or preoccupation with weight. But it's not necessary at every visit. And so thinking through, what do we do just because it's a habit or because that's what we do in our clinic versus what's actually necessary. And then what I didn't get into too much is language preferences, but what we find over and over is that when people have conversations about weight with their provider, they want it to be neutral. So they want to talk about weight. They don't want to be told how much overweight they are or how their weight's unhealthy or their BMI level or anything like that. They just want a conversation about health and about weight in a neutral way. Did I miss any part of the question?
No, I think you got that. I think that was great. I had one myself, and I know that we have 4 minutes left, but I really wanted to cover this. But I have a brother who goes to the gym a lot, and I was like looking, and he counts his calories down to like he weighs his food, and I had read this really interesting article in the Guardian about how a lot of people who go to the gym have something known as muscle dysmorphia. And, I think that you had mentioned this in the first slide when you were talking about Ariel, which yes, love that you brought in pop culture references, but how a lot of young men often feel the need. And, the Guardian article talks about how in the 70s, David Bowie actually set a different expectation for male bodies as being skinny. And but I think that what we see now with a lot of men, Marvel characters, etc., is that gym body, having that triangle shape, is coveted. And my own brother, I've often told him that his eating habits are unhealthy because it feels like I can't go out and enjoy just a simple meal with him without him self-deprecating and feeling that he's not following this extremely regimented schedule that he measures and follows everything. So just wondering if you had anything to say about young men, toxic masculinity, and eating disorders.
Absolutely. So you made so many good points even embedded in that question. I just want to highlight a couple of them. The first one is that we used to understand eating disorders like we started with Ariel, where it's this thin ideal. But there's been a real shift, I would say even in the past couple of years, not even that long, where we now talk about the appearance ideal. And I love that because it's not that everyone wants the exact same thin body, which is how, again, we traditionally understand eating disorders. It's that there is an appearance ideal that people will hold tightly to. It might be more muscular. So that was, Disney knew it in the 80s with The Little Mermaid. So they had that man who wanted the girl, and he became this bodybuilder type figure. And that was part of the appearance ideal for him. So it might be that. There are also cultural differences in what the ideal body is. And so it's unfair to think of it as uniquely thin, but it's still a problem if you're holding tightly onto an appearance ideal, usually that's unattainable, no matter what that ideal actually is. And I think the other point that I wanted to highlight about what you said was there's a level of dysfunction that or impairment that you were observing, that it wasn't just an interest in counting calories and going to the gym and building muscles. It was that there was the criticism and that you couldn't enjoy a meal with him because he was not enjoying it. And that's what we're going to be looking for an eating disorder, is life interrupted. Because if it isn't, then we have to rethink, again, with that idea of, well, what is health? If there's no impairment or distress, is there a problem? Probably not. But even if we don't see physical signs like we might assume we would see in eating disorders, whether it's muscular or thin, if there is impairment or distress, or you can't enjoy a meal, or you can't eat with anyone else and you're in secret all the time, that is a problem.
Thank you. Yeah, I really appreciate that.
Great. Thank you so much, Dr. Lydecker. That was a wonderful session. I really enjoyed it. Super informative, and obviously a really difficult topic to talk about as someone who also does eating disorder related research. It's really sensitive, but in this setting, you did a wonderful job addressing it. So thank you for that. Great. Well, in terms of reaching you with any questions, of course, anyone here, if you have any follow-up questions, the Whova app is wonderful because you can directly reach out to Dr. Lydecker, but also, of course, Dr. Lydecker, if you'd like to share your email or anything like that as well, that'd be great. But we're going to go ahead and sort of switch on to the next session while we're doing that.